Approximately 1 in 10 women will conceive naturally after the age of 40, while many other women in their 40s may get pregnant with the assistance of reproductive technology. Life at every stage is very important. Similarly, trying to get pregnant after the age of 40 is a personal decision and has its own advantages and disadvantages. It is very important that at the age of 40 or after the age of 40, you give yourself the best chance for a normal pregnancy and a healthy baby. Therefore, you should consider taking the necessary important steps before trying to conceive. Some healthcare providers recommend that you take prenatal vitamins along with folic acid. If you're in your early 40s, it is possible that your healthcare provider will refer you to a fertility specialist. If you fail to get pregnant after having frequent unprotected sex for up to 6 months. Others may advise that you see a reproductive specialist immediately, especially if there are specific reasons you may have difficulty getting pregnant. These issues may include irregular or missed periods, ovulation difficulties, or problems with your partner's sperm. Some specialists start by doing checks to determine if there is a problem with the way your ovaries are functioning. Next, they will check for problems with your fallopian tubes or your partner's sperm. If there are no problems, then it is possible that your infertility is due to age and declining egg quality. Your health provider will provide you with the necessary advice and recommendations depending on your individual circumstances. There are a few advantages to getting pregnant after the age of 40. Of course, every woman has their own reasons for the timing of their pregnancy. There may be more reasons that are personal to them that they could explain for having waited to get pregnant after the age of 40. Some women believe that after the age of 40, they are more experienced. They say that the possibility is that the greatest advantage of waiting to have children is that you've had time to grow and mature. You may be more secure financially and more comfortable in your career or your relationship. It is also possible that you and your partner, if you have one, have had the chance to get to know each other in a variety of situations, which can be a solid foundation for raising a family. Research indicates that older mothers are better educated than young mothers and do make wiser parenting decisions. Mothers over the age of 30 are also slightly more likely to breastfeed. Some mothers may think that they are more financially secure, so waiting to have children might also have financial benefits for women. This is possible because they are more established in their career. There are also disadvantages that come with having children after the age of 40. Everyone is always happy about the news of pregnancy. However, mothers are also concerned about the pregnancy and labor and, of course, the complications that may arise during the delivery process. At any age, these may occur. However, having a baby at the age of 40 and beyond can increase the risk of some of these complications. Some women encounter difficulty getting pregnant. This is one of the greatest disadvantages to putting off pregnancy until your 40s. This is a very important step. It is harder to get pregnant the longer you wait. This is because your egg supply decreases significantly as you age, and older eggs are more likely to have chromosomal problems, which results in the risk of miscarriage and birth defects. According to research, 40-year-old women who were treated for infertility had a 25% chance of getting pregnant using their own eggs. By age 43, that number decreased to 10%, and by the age of 44, it had decreased drastically to 1.6%. Among women who failed to get pregnant, the miscarriage rate was 24% for 40-year-olds, 38% for 43-year-olds, and 54% for 44-year-olds. It is recommended that you use donor eggs to improve the odds of getting pregnant considerably. Another disadvantage is that women who wait until the age of 40 are more likely to have a difficult pregnancy. Pregnancy complications are a major concern for women. In your 40s, you are far more likely to develop problems like high blood pressure and diabetes during your pregnancy, as well as placental problems and birth complications. Women are also at a higher risk of a small or preterm baby when they get to the age of 40. It is said that women who are older than 40 are more likely to deliver a low birth weight or preterm baby. Stillbirth rates are also higher, and studies indicate that children born to older mothers may be at a slightly increased risk of type 1 diabetes. It is also important to consider the quality of your partner's sperm. Consider the quality of your partner's sperm. If your partner's sperm is older because you're at the age of 40, then it is possible that it may lead to problems. Although it is said that men are physically capable of fathering children in their 60s and even in their 70s, sperm quality deteriorates with age, as does that of egg quality. Older men's sperm has a higher rate of genetic defects than younger men's sperm. Studies indicate that there are links between the father's age and genetically related conditions such as schizophrenia and autism spectrum disorder. Getting pregnant after the age of 40 could also put a strain on your finances. There are financial disadvantages to waiting to have children, but there may be liabilities as well. If you wait, you may have to continue working to an older age to afford childcare, or you may end up setting aside less for retirement because you have other expenses. In addition, fertility treatments can be very expensive.